Right, well, good afternoon and welcome. I'm going to open by addressing head-on some of the challenges that we faced last week, and I'm then going to make some comments on some of the second and third order economic and governance challenges. Heidi and Nikki will then speak as they have before. We also have welcome Dr. Peter Raby, who I'll introduce in a minute, and of course finally Paul Whitfield, the Chief Executive. Last week we stumbled, we wobbled, and I'm sorry for that. I don't need you to like me or like what we're doing, but in this crisis I need you to have trust and confidence in our decision making. But fortunately we didn't fall, and I have done some reflecting on what did we do what did we do wrong. And I spent some time thinking about why and how it happened, and I think there are three contributory factors. Firstly, the last press conference was on Tuesday evening. That was frankly too long ago. The resulting vacuum was filled by uncertainty and anxiety, and we won't make that mistake again. So for the time being, we will hold regular press conferences, at least 3 times a week, and of course we will have more if we need them. Secondly, although we said last week that we couldn't cover every situation, the initial guidance clearly did not provide enough clarity for you, and I apologise for that. If someone doesn't understand what you're saying, it's easy to simply get frustrated at that individual's lack of understanding, and frankly most of us do that all the time. But the reality is, if someone doesn't understand what we're saying, it's not your problem, it's our problem. We have to try and explain again. And that's what we did over the weekend. We took the time to revisit, revise, and reissue the guidance to business. And I'd like to take this opportunity to thank, in particular, political colleagues from the Committee for Health and Social Care for their hard work on this over the weekend with all the staff who assisted. And thirdly, I think we were initially trying to be too helpful without carrying you with us. This was interpreted as putting money or the economy over lives. Let me be categoric. That was not and never will be the case. What we were trying to do was, acting on public health advice, to identify those businesses that are low risk and allow them to continue to trade. And we failed to adequately explain what we were doing, and so it looked like we were rowing back in some way from the lockdown announced on Tuesday evening. And I admire the many businesses who have been in touch to say, you are permitting us to trade, but actually we don't want to, even though it will hurt us financially. I do want to address, though, one dynamic that did concern me last week. There was an element of the community whose main objection to the guidance appeared to be, I can't operate, so nobody else should either. And I think this is clearly a very human reaction, but it's short-sighted. We're not in some socialist republic where we all have to don a hair shirt with the objective that the whole community feels an identical level of economic pain. In the next few weeks and months, it is in all our interests that those businesses who are able to continue trading safely, in accordance with public health advice, of course, that they should be allowed to do so and that they should be as successful as possible. I said last week, when we find little evidence of widespread community seeding, then we will be able to lift these measures either permanently or on a temporary basis. It is my hope that businesses, or some of them at least, can start up again just as soon as it's safe and possible. And for that to happen, then 2 conditions must be met. Firstly, the public health advice must be clear that it is safe for any given type of business to restart. Whether that is a window cleaner working on his own outside, or the horticulturalist who desperately needs to water the plants to keep them alive. And secondly, the community needs to have confidence. I did refer to this in my open letter published on Saturday night. I need to feel that you trust that we are making decisions for the right reasons and which are in the island's interests. To build that confidence required rapid, clear and unequivocal decisions over the weekend, and that is what we provided. And that is what we've sought to do since this crisis began 3 weeks ago, and that is what we will continue to do. Nothing has changed. I've said this before, and I'm not embarrassed to repeat it again and again and again if I have to, and I'll keep saying it until you're sick of hearing it. The objective is to minimize contacts between households as far as possible so that we can reduce the rate of transmission of the virus and the number of COVID-19 cases, ensuring that our healthcare system is not overwhelmed. And therefore, the core instruction has not changed either. You must not leave your home except to exercise, to buy necessary food and supplies, for medical appointments, or to work, where that work is essential. And of course, we will have no hesitation in changing the rules and doing so very rapidly if they are abused, circumstances change, or the public health advice changes. If we need to limit your movements further, we will do so in a heartbeat, because the priority was, is, and will remain the protection of you and your families, and particularly for the benefit, of course, of the most vulnerable in our community. Heidi is going to talk in a little bit about some of the do's and don'ts of what lockdown should mean for you and your families in practice. Dr. Brink is then going to talk about the change in the number and type of cases and testing. And really all I need to say at this stage is that the numbers of positives going up is no surprise. It will go up further. Some of those new cases will need to be hospitalised. Some of those who are hospitalised will need critical care. And as we said last week, the hospital is now ready for that event. And Dr. Raby, our medical director, will talk about that as well as some of the challenges, for example, in relation to PPE, personal protection equipment. And we must brace ourselves for the fact that some of those who need critical care will sadly die. As many of you will recall, our colleague, Deputy Peter Roffey, was caught in the Boxing Day tsunami a few years ago. And I felt that the last couple of weeks we've been preparing for the pandemic equivalent. The water has been sucked out, and so we know that something is going to happen. The animals have fallen silent, a bit like our schools and businesses. And now we're waiting for the water to come back in. And we can see from the cases we have, the wave is on the horizon. The measures we've taken to mandatory self-isolate 1,500 islanders and to lock down are the equivalent of moving everyone to safer, higher ground. We will soon see how big the wave is. Testing is our equivalent of the Pacific Tsunami Early Warning System. That will tell us the rate of transmission and whether we need to move people to the equivalent of yet higher ground with more stringent restrictions. And like that tsunami, the psychological toll on the community of this crisis may be longer lasting and impact a greater number of people than those lost directly to it. I spoke last week before the lockdown of my fears for the mental health and well-being of the community. And now we are all isolated to some degree from each other. The need to look after each other's well-being, physical and mental, is greater than ever. And there is another group whom we need to have concern for. Those for whom home is not a safe place. They may be children or adults, and they may be the victims of domestic violence. And if you are one of those people, please reach out for help. It may be harder in these strange times, but there is still help there for you. Please do not suffer alone and in silence. The first order challenge has been responding to this public health crisis. The second is responding to the growing economic one, which in turn will put more stress on families. When the first restrictions were imposed only 2 weeks ago, it seems like a lot longer, I know, it was the travel and hospitality sectors that were the hardest hit. Now almost every sector is or will feel the consequences, and the consequent need for government's response has grown in scale. And I'd like to acknowledge the work of Deputy Lyndon Trott, who has been working on behalf of the Policy and Resources Committee around the clock to develop that response in a fast-changing environment. Most jurisdictions will enable their huge bailout packages to be funded by massive government borrowing and probably ultimately printing money. And I'm anxious that if we can, to ensure that we find a way to benefit from that rather than simply see our community penalised by its ability to tap into the reserves others do not have as a result of several generations of prudence in Guernsey. The third order challenge is around our governance. The Civil Contingencies Authority was designed for short-term emergencies, and this one is clearly going to go on for a little while yet. And with the state of deliberation not currently sitting in its normal way, there may be an absence of appropriate scrutiny of decisions taken. And although technology does allow remote working, the priorities and purpose of our committees has, for the time being, frankly, been thrown into the air. And so I've asked Deputy Latoc to lead a swift piece of work looking at whether we need to temporarily amend our system of government to manage us through the rest of this crisis. And any recommendations from the Policy and Resources Committee will, of course, be brought to the States of Deliberation in a policy letter as soon as is possible. So that's enough from me. I'm going to pass over now to Heidi. Heidi.
Thanks, Gavin. Now I'm going to start with a few positive points. Firstly, we have stopped charging for all emergency department appointments for anyone presenting with COVID-19 symptoms. No one must be prevented from getting the treatment they need because of cost. However, please don't just turn up to the emergency department. It's really important that you telephone through first. Now, last Thursday, we advised that we had all the testing equipment on island. Since then, a considerable amount of training, commissioning and testing has taken place since its arrival. And this weekend, the pathology team took over the testing for COVID-19 and our samples are no longer going off island to a specialist laboratory, though this remains a backup should it be required. Now, great thanks to our estates team, infection and prevention control teams, cleaners, procurement and pathology who have facilitated what's called a Category 3 laboratory process in weeks, which would normally take months. This puts us in a really great place as we can test. Now, both Gavin and I visited the PEH on Friday. For me, it felt like the eve of battle. Preparations have been made, staff have been trained, and the equipment is in place. We're as ready as we possibly can be for what is coming ahead. And our medical director will go into more detail in a moment. But this will be all for naught if we don't follow public health advice about staying at home. You should only leave the house for one of 4 reasons. Shopping for basic necessities, for example, food and medicine, which must be as infrequent as possible. Up to 2 hours exercise a day, to include walking, cycling, running or sea swimming or other open sea activities, alone or with members of your household. Any medical need, if instructed to do so by a healthcare worker or required to do so, having called 999 or to provide care or to help a vulnerable person. And finally, travelling to and from work where it is essential. These 4 reasons are exceptions. Even when doing these activities, you should be minimising time spent outside of your home and ensuring you are 2 metres apart from anyone outside of your household. It doesn't mean going shopping together as a couple or going shopping every day, blocking the aisles so no one can keep a distance from you, taking a drive around the island. All this does is consume fuel, which means you need to fill up sooner and increase risk of more contact. Driving to a car park and rolling down the window to talk to friends, riding your bike with others unless part of your household. It does mean using your 2 hours a day for exercise, either by yourself or with your family. It's been great to see families walking, running and cycling more this last week. The roads are safer with less traffic, so this is a perfect time to do it. Planning your shopping so you can get enough for several days. And most importantly, maintaining social distancing and adhering to strict hygiene guidelines. Wash your hands for 20 seconds on a frequent basis and follow the adage, catch it, kill it, bin it. Now, the number of cases are rising and we are seeing patients being admitted to the PEH with COVID-19. Things are going to get worse before they get better. And I was speaking to HSC's Director of Operations on Saturday when he said, "It feels to me like we're at the bottom of the hill. It's incumbent on each and every one of us prevent that hill from becoming a mountain. We can do it, but we can only do it together.
Okay, thanks, Heidi. So, Nikki.
So, thank you very much. First of all, to start off with an update of where we are with testing. And I think it's very encouraging, first of all, to look at the tests to show that we only have 27 tests outstanding. And that's been due to the availability of on-island testing. So, huge positive for all of us. And we're very grateful to the pathology services for all the hard work that they've done with regard to that. We've had a jump to 60 cases as of this morning. And what also is encouraging about that number is that 5 of those cases were identified through our contact tracing process. So the idea of identifying suspected cases, testing them and contact tracing them to detect any secondary cases, to try and interrupt that chain of transmission is so important. And the rest of our cases have been negative. So we now have a total of 504 negative cases. So just a bit of an update as to where we are now. The interesting thing about the cases that we've identified, we've also identified a family cluster. So the jump is a family cluster together with the at least five that we've identified through our contact tracing processes. So just secondly, to touch briefly on testing again, is we have the molecular testing on Ireland, so that's the direct detection of the virus on the nose and throat swabs. Really positive, because now we can move into real-time case management. So we can identify a case, and within 24 hours we know exactly where we are. And this will be fundamental as we move forward to try and control this pandemic locally. So really important. Now that we are happy that we've got the direct virus detection, the molecular tests on Ireland, we're also looking at antibody tests and what antibody tests we should be doing. We've been assessing various of the kits and seeing where we move forward on that. So that's been a very exciting development for us and will fundamentally help us manage the situation. The final thing that I wanted to discuss with you today, we've always said that we would communicate with you openly and transparently, is over the course of this weekend we've been dealing with a situation where we identified a cluster of cases in a care and residential home. So public health services were notified at about 10 o'clock that there were some of the residents with respiratory symptoms. A GP went in, took samples on three of the residents there. The pathology services came in and we ran urgent assays through the course of the day. By 7 o'clock in the evening, we knew that it was COVID-19. So really working together with regard to that. From there, on Sunday, community services put extra staff in to help the care and residential home. So that was really helpful as well. Extra stocks of PPE were delivered to help them as well. And from today, a specific cell to support care homes has been set up, led by a very experienced community care and residential home manager. So it's again wrapping that whole bundle of care around what we do and everything we do, but also the team working. We had community services coming in and helping staff the care home. We had extra PPE being delivered. We had pathology services running tests over the course of the day on Saturday, and we had public health services having a look at exactly what they thought we think is going on. From there, we've made a decision to test all members, all residents in that care home and all staff members to give us a very precise idea of what's going on. So we're operating with data that is relevant and is very timely, so really important for us. And finally, the message I want to say is, please everyone, stay at home, because you will save lives if you stay at home. So it's so important that we work together as a community on this.
Okay, thank you, Nikki. Peter.
Thank you. I'd like to talk a little bit about what we've done in the hospital to get ready for the tsunami that we've been talking about, and we'll see what the size of that is. We've been bought time by the strategy that Public Health have adopted and by the engagement of the public of Guernsey in staying at home, and we want as much time as we can to get ready. So everything I say is in that context. Please stay at home, make this as easy as you can for us. But we are fortunate because although our hospital is small, we're pretty well prepared, and we've used the time as best we possibly can. I'm just going to talk through the stages we've done that in. So a lot of this is working with primary care to make sure that they're clear about who needs to come to hospital, who should be in the hospital. And then we've got the emergency department, the medical service in the hospital, and finally the critical care service, which I'd like to mention as well. So we've worked very closely with our primary care colleagues to develop pathways that everyone's clear about who should be sent to the emergency department for consideration for admission to the hospital. If you come to the emergency department now, you'll see it's quite a different process to what you might be used to. Please don't come unannounced if you've got any sort of respiratory symptoms. But if you do arrive now, you'll arrive to a porta cabin just outside the emergency department where a nurse will triage you. She'll be wearing personal protective equipment, and she will triage you as to where to go in the hospital, because the emergency department now looks like two separate units. One is for patients who might have COVID disease and need to be handled in that section of the emergency department. The other is for people who just need to be seen routinely and don't present a risk in that way. So you'll be streamed to the right part of the emergency department. The emergency team are absolutely clear about who needs testing, who might need to be admitted, and what the process is for admitting anybody who has to go into the hospital. At the moment, we have a certain number of negative pressure rooms in the hospital. We have 5 negative pressure rooms, and we'll put our first patients into those rooms because that provides the best possible protection for staff and others in the hospital. It's likely we're going to get more than 5, and we're ready for that. We have side rooms which we can use safely with personal protective equipment, lobbies to put on equipment before you go into those rooms. And eventually, we're prepared to use entire wards to cohort COVID patients should we get to that stage of the tsunami later. It's all set up and ready to go. We know exactly who needs to be in hospital and who can be managed at home, and we're doing all we can to increase the amount of this that we can handle at home by ordering things like oxygen concentrators and that sort of thing for any overwhelming situation. We expect perhaps it varies between country, but perhaps 8% of people who present with a disease to need admitting to hospital, and in some places it's been a bit higher than that. We'll see what it looks like in Guernsey when it arrives. But remember, for most people, this is a mild disease that can be managed in your home. Of those we admit to the medical boards with COVID disease, some of them are going to need critical care. We start pretty well off for critical care beds compared to our UK peers. That's because we don't have easy. We can't put you in an ambulance and drive you down the road to the hospital 30 miles away. So we have to have a few more beds than a UK hospital does. So we started off in a pretty good position for that compared to the UK, but we've done a huge amount of work. And I'm so proud of the teams in the hospital, I'm going to say. But a special shout out to the estates team who've just been fantastic with this. And we've converted the day patient unit into an intensive care facility which can take up to 15 more ventilated patients with COVID disease should we need to. Just to give you some idea of scale, the number of ventilators we have, at the moment we have enough ventilators and monitoring for intensive care patients that we've got more than the UK will have when they get all the ventilators they've got on order at the moment per head of population. So we're in a very good position for this. We can still be overwhelmed. If any health system can be overwhelmed with this disease, and that's why it's so important that you stay at home, follow the public health advice, and that we get as few people as possible into the hospital. I've probably talked long enough on this, and I'm happy to answer questions, but I'll be quiet now.
Great, excellent. Thank you very much, Peter. And then Paul, just to talk a little bit more about some of the other public service challenges and issues.
Absolutely. I'm conscious, as Gavin points out, that we're constantly updating and amending and making further arrangements, which I'm sure for many have proved to be slightly confusing, and this is why we've really attempted to provide stronger clarity in the last 24 hours. And made those amendments which fundamentally are to reinforce the message to stay at home. I'd firstly like to say thank you, because the response just since yesterday afternoon has been fantastic by businesses adapting to those more recent changes. But we are conscious that people still would like to know how it applies to their specific situation. So we would really encourage that if you're running a business and you're not quite sure how the definition works or how it would work in your specific case, please email at trade@gov.gg. We have a team of handlers waiting to respond and help and support at all. Conversely, if you are starting to suffer in terms of hardship of the way you employ your business, again, business.support@gov.gg. Again, we have teams that will help in how we could apply help to assist your business. And I think from that point, I'd really like to mention we're conscious we provide an awful lot of services in government, and the information we're pushing out can itself become confusing. So we've refreshed our web page at gov.gg coronavirus to provide a fairly clear list of the escalating number of helpline numbers and queries. So we've tried to put them all in one place and make it clear this is the link and this is the purpose of that particular helpline. So I would encourage you to visit that site and get the first-hand information. I suppose running public services on the scale that we do presents us in government and public services with its own challenge. And how do we operate? Because actually when we talk about essential services, the very nature of public services, many of our services are essential. So how are we doing, and how are we going to keep business running to provide certainly essential information? I will give by way of example, Frossard House normally has about 400 staff pushing out essential services to our community. I left the building this morning with only 6 people in the building. However, we must do that in order to support the stay-at-home message, protect our staff. But what are we doing to ensure we keep clear lines in providing essential services? Well, we have worked, as we have done with the ICU, tirelessly to roll out more technology, more mobile phone capability, and actually call handling services that staff are operating from their own homes. We are now able to offer services in population management, revenue services, vendor services, our HR support teams, as well, and importantly, is our employment and social security, which is operating both from Edward T. Whedon House with teams on site, and also a large portion of their staff operating from their own homes to provide services and contact points specifically for people to access both benefits and the hardship fund. Clearly, this is an ongoing challenge for us in the public sector, but we are determined as far as possible we can keep our contact and essential services going for the community. We would rather be asked than not asked at all. If you're unsure, if you need help, our service might be slightly clunky. Be patient with us, but we're making every attempt to keep our essential lines of contact going. Thank you.
Great, thank you very much. Before we go into questions, I'm just going to direct a question at Nikki and a question at Peter, because I know they're issues of concern to many. One is, Nikki, in relation to the so-called antibody testing, which is obviously being talked about more in the media, could you just spend a moment just to explain what the team at Public Health are thinking in relation to that, how it might apply, and how it would be most relevant for it to be applied in Guernsey?
So with the antibody test, the first group that we'd like to look at are our health and care workers. So those that we think have had an infection, to test for antibodies to see if they indeed do have antibodies. So that'll be the first group that we'd target. So we're learning about this virus the whole time, and if someone has antibodies, we're not sure that they'll have long-term immunity, but we think they'll have some short and intermediate-term immunity. Now, of course, those healthcare workers would still use PPE and so on when they're looking after infected individuals, but it would just give us an additional level of confidence and give us an idea of the rate of infection within our healthcare staff. So that would be really our first project, or our first aspect that we would look at. From there, we'd like to do a larger scale, what we call a seroprevalence survey across the population, and just get an idea of how many in the population have been infected. As we learn more about this viral infection, what we see is that there's a spectrum of clinical presentation. And interestingly, talking, because I phone out a lot of the positive results to speak to everyone when they're diagnosed, is some of them do have the classic symptomatology, but other symptoms such as diarrhea, loss of taste, just generally feeling fatigued. Most people that I've phoned said, I've just felt so tired. So we're learning more about that. So what we want to do is look at what the infection rate across the population is. So the first thing would be to focus on our health and care workers, and then to move on from that and look at a population base, how many people have been infected in the population. And we're hoping with the second one, there'll be technology evolving that will allow us to test sort of 80, 100 people on a single test run. The initial tests that they're using are the cassette type tests, a bit like you see with some of the other rapid testing that we do. And that's sort of like an individual test. So there's an initial strategy and a longer term strategy.
But the idea that people will just be able to test themselves at home, that's not where you imagine
No,
we will
we are hoping, we don't want to have a home testing, because I think it's important to collate that data. So what we're looking to do is have some sort of drive-through type of testing where people come and get their antibody test and we validate the result. And I think it's really important. And we'll also then start collating data to look for the evidence of what is going on within our population. So that's what we're planning.
Great. But it's still some way off.
It's somewhere off.
Yeah. Okay, good. Peter, the other issue which I know, again, has been in much of the media is this question of getting all the right PPE.
Yeah.
And could you just explain where we are in addressing that challenge?
Yeah. So we're using exactly the same guidance as the NHS England are using for use of PPE. There's a worldwide shortage of personal protective equipment, and everywhere in the world is trying to get hold of it at the same time, and we're part of that problem. So we have PPE in all the categories at the moment, and we want to make the best possible use of that. So we are controlling the stocks carefully. We're putting it where it needs to go. We're adopting best guidance, and we're expecting more guidance to be delivered from the UK today, and we will be adopting the best guidance we can from the UK on that. And we're maintaining the stocks. We've got orders in for lots more. I understand that our share of the NHS supply chain order has been dispatched to us now, so we're expecting that to arrive soon as well. And we're trying to make contact with, we are in contact with other companies, new companies that are able to source some of this for us. So we're doing everything we can, including development locally if we can of any of this equipment. So we're on the case.
Great, excellent, thank you very much. So we'll open up to questions. Again, if you wouldn't mind ask your question loudly so it's picked up for the benefit of those listening in. Please.
To the mic. You were talking about testing. Can you describe, it's probably a few weeks down the line, what sort of environment would have to exist in order for lockdown to be lifted, and what sort of population testing would have to exist for that to happen?
So what we want to do is we'll be changing our testing strategy as from tomorrow, and we're just working that up as we speak. But what we're thinking about doing is doing a broader base of community testing of people with respiratory symptoms, so people presenting to the long-free surgery, for example. So we've got fewer people returning now, so we want to fundamentally focus on what's going on in the community. When we get a good idea of the level of infection within our community, we'll be able to make a more informed decision. We'll be able to do some modelling. But we need that basic evidence, that data, to actually get a time point now and then start modelling as to where we think we're going. So we can't give you a precise number that we will stop a lockdown on X, but we need to look at what we've got, what our trajectory is. So we need to do some calculation on that, and based on that, we'll then be able to give a more precise advice on lockdown.
Okay, good. Next question.
As you mentioned right at the start about the little wobble that you'd had regarding the critical workers, what was the feedback you received which made you realised you needed to perhaps change things?
I don't think there was any specific feedback really. I think it was clearly the number of queries that were coming in, and just a sense of confusion, to be frank. So it wasn't difficult to interpret that as we need to do something about this, because we clearly have not managed to communicate what we were trying to achieve in the way that we had hoped. So hence the going back to the drawing board at rapid speed.
So I just think people have been too willing to try to help. A lot of inquiries saying, what does that mean for us? And people were really trying to say, well, how can we make this work? That they're low risk. And I think the message was lost from the original, we're locking down. People found it difficult to then understand when we were talking about risk. Because a gardener working in a garden professionally by themselves are exceedingly low risk, but that didn't match with the message that lockdown, stay at home unless what you're doing is essential. And I think that's where we needed to step back and say, right, and also where we've got the community now anyway. We couldn't imagine that even 3 weeks ago, certainly not the beginning of the year, if we were to tell people, right, you've got to stay at home unless it's absolutely necessary. I think the population would not have been there with us at that particular moment in time, but I think people are now, and are understanding of what we're likely to face and what we could face, and understanding that we all need to stay at home and unless we have to go outside for particular reasons. People are in that place that they didn't understand then, having messages about risk and saying, well, yes, they can work because they're low risk, it doesn't matter. They want everybody to feel like you're only going out there if what you're doing is essential. And I think just standing back and saying, okay, this is where we've got the population at the moment. They want us really to say, this is what we want. Let's revisit it. Now we know we got that feedback, and I think it's been really invaluable to us, to be honest with you. So I think we've really got it in a very good place. The directions as a committee that we have given could change. Things have been changing so quickly. I mean, from 1 week to the next, from one day to the next, from 1 hour to the next, things are just changing. So it is quite possible that we might be tightening up even further before we loosen up again. So this is where we are. We are flexible. We weren't going to fight it and say, no, this is what we're going to do, and we're never going to change it again. This is absolutely, we have to flex it and make sure we're in the right place. And I absolutely think we do. There's a lot of hard work going on over the weekend to make that happen. But I really do think we've come out this in a far better place than we were.
I think Heidi's point is a really important one about carrying the community with us. I mean, government is only so big. So I think there is, in a crisis like this, there is a perception that government just needs to direct something to happen, and it will happen. And I've made this point before. The reality is we haven't got thousands of troops we can deploy to the streets to enforce a government directive. So therefore, we do need the population to be with us, to understand what we're doing and why we're doing it. And I think that, which is why the emphasis on confidence and trust in the decision-making process is so important, and which is why communication is so important, is in order for us to be able to move the levers either way, to either restrict further or to loosen up, we need the island's population to have built and gained that trust and confidence. And I think that is such a valuable commodity that we can't risk impeding that. And
also the advantage we've got as a relatively small population, we get that feedback, we can act on it so much better than a larger jurisdiction that can be far more isolated from its people.
Okay, next question. We'll go here. Yeah.
Of the 60 positive cases, Dr. Brink, how many of those have been attributed to community seeding?
We're still contact tracing and evaluating the ones that we received overnight. So with regard to that, when we identify a case, I phone them or a member of the clinical team phone and discuss the positive result. They then have an interview which lasts about an hour, and from there we ascertain where we think it's likely to have got where they've likely to have got their infection from. But a significant number now have acquired their infection locally. So I would say probably in the region of 8, 9, 10 have acquired their infection within Guernsey with no obvious link externally.
Okay, next question. Yep, at the back.
Have any of them recovered? Once they've recovered, would they become immune, or would they still be classed as carriers and risk? Would they still have to remain in quarantine?
So the protocol that we use is that after an infection, we do a follow-up test on day 11 and day 13, and people have 2 negative tests taken 24 hours apart, and we then consider them no longer infectious if both of those tests are negative. So we're having a look at that. We might well shift to 1 test because we're getting increasingly confident with our testing, but people have to have a negative test until before they come out of quarantine. That's really, really important. So we have to be sure that they're not infectious anymore. The testing that we use is highly sensitive, so if we get a negative result, we can be confident that it is negative. And once someone gets a negative result, they then can come out of quarantine, but they remain under lockdown rules. The second question is with regard to immunity. It is likely that they will have some short/intermediate term immunity. Whether they will have long-term immunity, that question remains to be answered. This virus only entered the human population in about November last year, so we don't have much data on it from a time point of view, so we need to get that data. But certainly, from what we see, it seems that they will have short or intermediate term immunity.
Did you say how many has any of them recovered so far?
Yeah, so we have had, if you're looking at the negative testing, we've probably had about 3 or 4 that we've done follow-up testing, and they're negative, and they'll be released from quarantine. But it is a long process, so it's a 14-day process, and we need to be sure that once people have had the virus, that when we say they come out of quarantine, that they're not infectious anymore. Otherwise, we just then start a cycle again. So we've always had a very conservative approach, and I've always said this to you, is that we've had a careful conservative approach with regard to our strategies.
Okay, Heidi.
Yeah, I was just going to add, I know people, there's a quite a frequently asked question, have people recovered? And we're looking at, and Nikki might be able to say a bit more here about improving like a dashboard for the website, so people not only just see, how many cases, how many positives, how many negatives, but also look at the recoveries as well. I think that would help give people some assurance as well. I don't know if, Nikki, you've got anything more to add?
No, I mean, we're looking at that dashboard, but also there's clinical and virological recovery. So the overwhelming majority of recovering or have recovered clinically. So most people have, some of them have felt pretty rough, but most people are well on the road to recovery now. So that's the clinical side of it, and then there's the virological clearance. So I think we've got to look at both sides of it.
Yep. And you wouldn't class somebody as recovered until they were you were happy with them from a virological point of view.
Yeah, we wouldn't class them as wanting to release them from quarantine, but they might have recovered clinically and feeling fine. And in fact, a few have been quite frustrated. They've said to me, "But I feel fine," and I've said, "No, you've got to wait for your virus test."
Okay, good. Next question, in the middle.
What can you tell us about the patients at the care home, and do we know how they were able to come in contact with the disease?
So we don't know about how they came into contact with the disease, and I'm not sure that we'll ever know that information. There are 3 people that were involved, and 1 is admitted to hospital.
Okay, next question. Yes, on the right.
Have you got any idea at this stage when you might be able to see if social distancing is working, and when we might be able to see if the flattening of the curve has worked?
It's probably a question for you, Nikki.
Yeah. So what we need to do is get further data on our community testing, and I think we will look at that, and we're hoping in 2 to 3 weeks' time we'll have enough information on our testing to see exactly where we are. We're also getting what we call other epidemiological data, so the GPs are reporting to us information on respiratory tract symptoms and all that. So we're using both qualitative data on what we're told, as well as quantitative data on what we're measuring from the view of the test results. So we're using both. And I think we're too early on to start making predictions on that.
Okay, thank you. And then in the middle.
Just regarding the person who was admitted to hospital from the care home, are they the only person who's been hospitalised with COVID-related symptoms so far?
No. We've had 4 patients hospitalised. 5 patients hospitalised. 2 have gone home, and 3 remain within hospital.
And what condition would you describe them as being in?
Peter, do you want to answer that?
I don't want to give details of any particular patient's details. Of the 3 in hospital, 2 are very well, or doing well. 1 has comorbidities, and we know that age and comorbidities increase your risk, so we are concerned about 1.
Okay, thank you, in the middle.
Can you talk to us about the age range of people being tested for coronavirus? We obviously, lots of rumours going around.
So the median, I don't have the information, the numbers on the people tested. However, of our positive cases, we've looked at the median age, and the median age is about 50. In the UK, it's about 48. So we're slightly older than the UK, but in the same ballpark figure, and that would probably fit with our ageing demographic.
Are you able to give us details on the youngest person tested?
The youngest person tested positive, I think, would be in a teenager.
Okay, next question, please. Yes, on the right.
Are you able to tell us how many arrests have been made so far in relation to the lockdown and people breaking those rules?
I'm afraid I don't have that information, do you?
No, I don't believe there's been any arrests as such made at this stage.
I think there has been some law enforcement action, but as you've said before, Paul, and as the chief, as the head of law enforcement said before, the first approach very much is a soft approach to disperse people if they're gathering and so on. Is that right?
Most definitely, yeah.
Good. Okay, one and then in the back.
Just to go back to the teenager being tested, was this expected from someone so young, and what steps are being put in place, and what's the advice to young people?
I think the advice to young people is that everyone can get this virus. And I think that's really, really important, is a lot of focus has been on older people and the effects on older people, but this virus can affect everyone, and we need to be really aware of that. So the message I want to get out is that all of us are potentially susceptible to this virus, and we all need to follow the public health messaging. And I think that's really important.
The teenager in question, are they doing well?
Yes, they're doing well.
Good, at the back.
How many applications have there been to the hardship, and is it enough?
Again, I don't have the detail, the number of...
I don't, but it's a good question, and we are looking to create a total dashboard. Obviously, this is a big impact to our own funding mechanism, so it for good reason we need to have good visibility on where the spend pressures are and the use of funds and increase on benefits. So we are building dashboards to try and support that sort of evidence base as we speak.
Okay, any more?
Just a couple of questions from BBC Guernsey listeners. One of the questions was they wanted to know why yourself and Heidi both went to the hospital last week to look at facilities.
Well, we wanted to see the facilities, and we tried to maintain social distancing throughout. And I think it's very important, actually. Yes, we know that's the case. We're trying to keep distance here. But it was actually to be able to see people and just to make sure that things are working, and to thank people for all the work they were doing. So, yeah, we have been maintaining social distancing. We've had a lot of virtual meetings over the weekend, which we'll we'll have probably more and more. But yes, we're aware. But you'll actually see photos that I posted on Twitter, which showed that we were maintaining social distancing as far as was humanly possible.
I think Paul wants to come in, but I mean, I would say that for us to be able to speak with confidence about the positive story of the pace at which that redevelopment had taken place in under 2 weeks, I can't speak with authenticity unless I've actually seen it for myself. So, and I think it was an entirely appropriate
Yes.
thing to be doing.
And we didn't want to be disrupting them twice. So, yes, Gavin could have gone along and I could have gone along separately. But I think if anybody had seen the video that I took, which, apologies, my filmmaking is not great, but they were seeing that there was a lot of work, that people were being trained and and equipment was being put in place. So I think we should be allowed a bit of a let-off for that one. But otherwise, we are very much maintaining social distancing and having virtual meetings on a regular basis.
Paul?
Yeah, I think it would be of interest to the community to understand, earlier expressed how many people work for the states, and the fact that we are all having to meet and communicate to do a lot of the work we do, and isn't that a risk in itself? Normality seems a long time ago now, but it was not so many months ago, just at the back end of the year, when we announced really sort of a complete revolutionising of the way we run technology across the states. We are now operating totally remotely. We are, just over the weekend, we were all in meetings throughout the weekend, all from our own separate dining rooms, with visibility, running with documents, conferencing, and this is happening all day. We are operating with our stay-home policy, using our technology, but continuing the business of the states.
And I think it's safe to say we would have struggled to have achieved that a few months ago.
An absolute empirical message, we could not have done this a year ago. The states and its employees are operating remotely using the technology we got out of those developments, and it's just fantastic. The timing has been great for us because we are now being able to work at relative pace in order to support this quite difficult crisis.
I would also add that we wanted to see Jessic earlier in the week. We wanted to go to the DPU looking at the new ICU earlier in the week, but events overtook us, as we all know, and the announcements that we made following day from when we were intending to do it. We've not visited Jessic because it is a much more confined space, and particularly for that reason, we've not gone there. But Gavin has sent a message to Jessup to thank them for the hard work and really the sheer numbers of calls that they've been getting and dealing with. So it's my opportunity here now to thank them as well.
Okay, next question.
Yep. Just regarding the other islands, first of all, are all the positive cases from Guernsey residents or other members of the bailiwick?
They're from Guernsey residents.
Okay. And regarding Jersey, is there any agreement with Jersey for them to use our testing facility?
Again, it's probably best for you to answer that rather than me.
So I think at the moment we're just rolling out our testing system, and we want to be confident that we can cope with the numbers that we have, and be confident that the throughput is going through, that we're able to staff it, because at the moment we're staffing into the evenings. But of course, if we have capacity, we'd gladly talk to our sister island with regard to sharing the technology we've developed.
But politically, certainly, we've indicated a willingness to support if we're able to, but it obviously will be led by our own clinical need. Yes.
Going back to the care home.
Sorry.
Do we know which care home it is, and is there worry now for other care homes on the island, but also is there now a lockdown on that care home in terms of people getting in and out of the building?
The answer is that we have a care home cell that is specifically going to focus on the needs of care homes, led by a very experienced care home manager. So that's the first thing. Secondly is I don't think I can particularly name that care home because I don't think that would be fair, but there are very specific measures in place in regard to that care home, which we've developed over the weekend. We have community staff, as I said, working from health and social care, working in that care home to support them. So we're doing all of that. We're also doing broader testing. So there are specific measures that are being put in place.
I mean, the lockdown applies to care homes as it does anywhere else, that people shouldn't be visiting at this present moment in time.
So yes, to be, for the avoidance of doubt, visiting residents of a care home would not be regarded as being essential travel.
No.
I think there's a question here.
Yeah, how much more scope is there for further support financially for businesses, and are you thinking about increasing that at this stage?
I mean, it is being, the economic package is constantly being reworked as we get new information in from business in terms of their need. I think it really emphasising a point I made right at the beginning of today's event. Only 2 weeks ago, we were really focused on shutting down travel into the island, which had a clear and obvious impact on travel-related sectors. And yet, within less than 2 weeks, we've locked down the island, and has a much wider economic impact. So the economic planning is very much playing catch-up with the public health measures that are being taken. In terms of the overall package that's going to be needed and the cost that's going to be required, again, in all honesty, I can't put a number on that at this point, because we still don't have any real sense of, firstly, how long we're going to be locked down, and secondly, how long it'll be before the economy is up and running and motoring again. And the third element to that is linked to the first two, because we don't know how much economic damage will be done. It'll depend on how long we're locked down and how long it takes for us to recover. So those three elements mean that it's actually quite difficult at this stage to put a number on it. But all I can say is it is this, as I described it when I opened, it is our second order priority. We absolutely recognise this is an economic crisis, and as every day goes by, we know that's going to put more and more financial stress on businesses, but ultimately it's going to put financial stress on individuals and families, and all that comes from that in terms, again, of mental health and well-being and all the consequences of financial stress. So we are absolutely not ignoring it. It's very much part of our strategy. Sorry, Heidi, were you going to?
Well, I was going to say this is where the whole community, again, can help. I mean, from landlords' point of view, what they can do to support tenants who might be struggling to pay their rent. Other parts of the employers, what they can do to support employees and just people, employees themselves, and in terms of what that they're being paid while they're not working or not paid as much. This is where the community comes together and see how it can support itself as not just government. We can't really plan for until we really know where we are after the testing, as Nikki says, and that might result in more measures being needed from an economic point of view. But it's really the whole community can help. As I say, it's not just government that has a role to play here.
And also, we are aware that a number of people have approached wishing to know whether they can contribute to the hardship fund. Again, as perhaps something that an individual or a family could do themselves given their own position. That is something, again, that is being actively considered as how that can be facilitated. Yep, we'll go here and then to the left.
Peter, I just want to highlight a point you made. You said that about 8% of the population were likely to go into hospital at some point. Do you think that Guernsey Hospital has enough beds to support this?
I said 8% of people infected with the virus, approximately, and sometimes higher. It depends on how it hits that particular country. Yes, we think we've got enough beds. We're prepared for the coming storm. We are doing what we can to get more beds available. We're looking at, can we manage more people at home on oxygen, that sort of thing, if we are overwhelmed. Because like any healthcare system, as I've said, it's possible that we can be overwhelmed. But at the moment, we feel well prepared. We've got a ward completely empty and ready to accept COVID patients already. We've got the ward next door to it. We'll become a second COVID ward if need be. And then beyond that, we can expand into a further ward. And beyond that, we have further plans too. So we think we've done the preparation.
It all depends on that when we get all that 8%. I mean, if we get everybody infected in a very short space of time, that 8% will hit us like the tsunami that Gavin spoke about earlier. It's about flattening of the curve again, staying at home so we stop that spread. So if we get that 8%, it's over a longer period of time and we can manage it well, and we don't have unnecessary deaths as a result of not being able to treat people all at the same time.
Yeah, so I think describing Peter's job is very much to plan for the worst, and to make sure that he has got access to all the facilities he needs if the worst case happens. Clearly it's Nikki's job to help us avoid getting to that worst case, which of course is why we've taken the measures we have taken early in the hope that we won't get to that worst outcome.
A week ago, you said we should be preparing for 14 days of lockdown. It's nearly a week since lockdown was imposed. Realistically, do you see lifting the conditions in another week's time, or should we be bedding in?
Well, let's be fair, it's 5 days, and we said we'd review it at the 14-day period. So, you know, I think it's, I respect the question, but it's far too early really to be commenting. I think, you know, there's clearly, as we've said so many times before, this is a fast evolving story. The information that Nikki is going to get between now and this time next week, in terms of the local testing, the speed that can now happen, will give Nikki a very good position to be able to advise on the rate of community transmission that will then inform where we go from here, whether the period is extended, and if so, for what period, and so on. So it's just premature.
It is. It's all going to be based on evidence.
Yep.
That has determined the approach we've taken throughout this, and it'll be evidence that will decide whether we release the lockdown or not.
Okay, we've got one more question, and then we'll finish for today.
Yeah, can you please confirm how long it was before you got the test results back from the care home, and how that compares to relying on off-island testing?
We heard about it at 10 o'clock in the morning. The samples were taken, I think, round about 11 o'clock. We tested through the afternoon and we got the results at 7:30 in the evening. So fundamentally different, because we were able to manage the situation in real time and not wait 2 to 3 days and then be trying to manage a retrospective situation. So the availability of on-island testing is a game changer for us.
And it's good news, and I think it's good that we finish on some good news. So thank you very much, and we look forward to seeing you again. And as we said, it won't be quite so long to the next one. We will attempt to have at least 3 of these a week. So thank you very much indeed. Thank you.